Welcome everybody to the 2023 Conv 2X Symposium on Blockchain and Healthcare. My name is Dr. Alex Kahana. For those who know me, I wear many hats. I am a UN and blockchain expert in healthcare. And for the last 10 years, I've been trying to blockchain healthcare and healthify the crypto space. I'm super excited for today's talk. We're going to have with two good friends, Dr. Ron Harris, who is the co-founder of Afia Record and has extensive experience in building NGOs in Africa, and Michael Ekpushe, who is the director of Afia Record in the United Kingdom and founder of the Afia Life Foundation. And today we're going to talk about decentralized health and Ubuntu, what Africa gets and others don't. So before I start, maybe just a simple question out of the name. Michael, can you tell us what Ubuntu is?
Ubuntu, I'm not quite sure what it means.
Okay, Ron, what about you?
Let's see, Ubuntu. I'm going to have to punt on that too, Alex.
Okay, well, I didn't mean to catch both of you, but it's good because I think that it's good for the audience to know. Ubuntu, which is a concept that comes from the southern part of the African continent, is we are who I am, or I am who we are. That talks about the community and the importance of community, which is quite different to, I want to say, the hyper-individualistic attitudes that we have in the West. So with that in mind, perhaps we'll talk a little bit about that and how that impacts your work in Africa. So let's start with Ron. Tell us a little bit about you and your work in Africa.
Sure. So thanks for the introduction, Alex, and appreciate being here. Thank you very much. So I am an academic dermatologist. I also in private practice, done global dermatology for about 20 years now. I've been involved with a few NGOs, including my own, and working for a while with the Clinton Global Initiative. I've been doing all kinds of things. You know, we've worked in Kenya mostly. We've managed HIV clinics, provided dermatology care to a hospital with a couple of million people, serving a couple of million people in the Upper Rift Valley of Kenya. Done some work in Ethiopia, teaching residents and doing conferences, and it's been a very fun journey.
I appreciate it. I appreciate it. And Michael, what about you? What brought you to the working in Africa and the African continent?
Thank you very much, Alex. I think for me, it was a bit of COVID. I think nobody was expecting COVID. COVID happened, and it really hit hard in terms of welfare across Africa, standard of living, standard of life, you know, down to even, you know, families not being able to feed and things like that. So I think there was a particular video I came across online, and it was an old lady who was practically during COVID, who was practically begging for palliative just as a result of not having anything to eat for her and her unwell child. So again, you know, for me, that sort of like broke my heart. And being an African myself, it then made me realize how deteriorated or how bad the system or things have actually gone in Africa, and there's a lot of factors to that. But having said that, that sort of like spurred an undying need to participate and be part of the change for Africa, and see how we then use that change to save life, and most importantly, you know, tackle the issue of healthcare around Africa, because that's one of the most important you know, pandemic on its own face in Africa as it stands now. So that sort of like was the genesis of my journey into the African space to make a difference.
Nice, nice. Ron, I assume that Many in the audience haven't visited ever Africa. And of course, it's very difficult to generalize a continent of 1.3 billion people in 54 countries.
Sure.
And there are places like Johannesburg, Cape Town, Cairo, Nairobi. You can't compare that to smaller rural areas in other countries. Could you paint a little bit your experiences, maybe share a couple of countries that you have experience with and speak to the differences of these between the countries?
Sure. So, it's interesting that you mentioned this Ubuntu, and I think of it as community. I think of it as Ohana, in Hawaiian. And in more business sense, I think of it as kind of a collective responsibility. And I think one of the things I've noticed throughout Africa is something that Michael was talking about, and that is there does seem to be a collective need and a collective want to improve healthcare all over sub-Saharan Africa. And I haven't been above the Sahel, but certainly in sub-Saharan Africa. And as far as differences in countries, it's very interesting. I don't know. I think there's both. I think people recognize the need for improved healthcare. I think people recognize the need for increased resources to healthcare, to new technologies, to different ways of communicating and different ways of storing health records. So I think that's pretty universal. And as far as differences, I think obviously there's cultural differences. I think in a lot of different countries, there is so much more in Kenya, there's more of a tribal approach to the counties, where as in a country like Ethiopia, there are so-called tribes, but there's not as many. And I think that makes a difference in some of the politics and certainly some of the ways things get done.
Wonderful, wonderful. Well, thanks for giving a little bit of a feel.
Sure.
Michael, you were talking about COVID and mentioning, the importance and your drive to improve health in Africa. I got heat by writing that Africa dealt with so much better than the US on COVID because, we are not used to having pandemics and following, public policies, and no one in Africa was exercising their constitutional right not to wear a mask. So there's clearly differences in how COVID was treated in Africa. Could you tell a little bit about what Africa is doing different in terms of healthcare than what we're used to seeing in high-income countries?
Yeah, thank you very much for that question, Alex. Again, when you look at the African ecosystem and the African terrain, again, healthcare as in a whole has been something that we've continuously and consistently battled with in Africa. And there's been a massive, prior to COVID, there's been a massive divide whereby Africa feels disjointed or disconnected from the rest of the globe in the area of healthcare. And if you then look at the whole healthcare ecosystem, you then wonder what are the things that the West is doing very well in terms of healthcare that make the healthcare more sustainable. Then primary care comes into it, being able to create that first line of contact that is sustainable, that you can then lay every other things on, which is a little bit similar to blockchain as well. But again, we don't have that in a sustainable way. And again, I think a lot of that has to do with lack of infrastructure, lack of funding, lack of better management. Again, corruption is part of that as well. But having said that, I think what Africa has then been able to do very, very well and effectively, thanks to this modern generation of young Africans and entrepreneurs, is to use the fourth industrial revolution, which we're still, in at the moment, which is the, technology age, to then use that not just to individual advantage, but to think about, again, Ubuntu, you are because I am, and I am because you are. So again, how do we then collectively as one ecosystem, begin to use these technologies to solve our problems? And the one thing Africa has done very well is run with those technology, and those technology has then helped us magnificently in terms of leapfrogging the rest of the world as a result of lack of infrastructure. So again, what we lack in infrastructure, we make up for in terms of technology and using those technology. But again, the dying concern with the technology is that, especially with the smart technologies, we talk about AI, we talk about blockchain and the rest of them, it's not really been fully regulated into the African ecosystem. So regulation is part of the challenges that might, affect the leapfrog of Africa if, again, that is not quickly done. And having said that as well, aside that, again, the whole ecosystem as a whole needs more knowledge. So again, massive education in terms of technology then has to come in. And all of this, again, has to do with a lot of funding. So, even though Africa is doing great and, using the technology to solve its own, dying problem in terms of health care, it's important that the world understand that Africa needs every knowledge they can, because again, we've suffered from the divide for, I don't think there's any other continent that suffered the divide as much as Africa. So yes, there are positives that we can take, and that's the technology age. And, again, there's a lot of stiff rigidness, again, that comes into that. How quickly are people ready to change, moving from paper-based, to technology or computer-based? And again, going back to education, knowledge. So there's a lot of training that has to go into place. So there's quite a lot still to do. But the good thing is Africa is going in the right direction, and there are need for strong, sustainable supports.
Oh, I love that answer, Michael. Thank you so much. I'm sure that people are trying to wrap their head around, this leapfrogging, and you mentioned the fourth industrial revolution or Web3 transformation, which is a great segue, Ron, to dive a little bit deeper. You're the co-founder of Afia Record. So, can you tell what is different about how you guys conceptualized the Afia Record and built Afia Record when you compare it to, I don't know, the large, without using the E word or the C word, or the difference between that and what we are calling electronic health records, and maybe, of course, allude a little bit to blockchain.
Sure. So, part of the reason why we started this, and co-founder and I, John Kamar, we had similar experiences in healthcare. Having been a provider there for many, many years, one of the things I noticed was just the lack of mobility of data. And that lack of mobility has led to increased mortality, increased morbidity, and just a state where, as Michael was saying, that there was just not enough. There was not enough infrastructure, and not enough technology to provide effective healthcare to Africans. So one of the things I think that is a little bit different from some of the legacy systems elsewhere in the world is that we make mobility of data key. And so that mobility involves sovereign ownership of data. And that's one thing that just doesn't really happen in some of the legacy systems. And so we wanted to make a platform that was patient-centric, that where a patient could have access to all of their health data from anywhere, from the lab, from imaging, from radiology, from genetics to clinic to a hospital, and have control of that data on their fingertips. And so that was one of the things that we thought would be incredibly important as part of this fourth industrial revolution, as Michael said, to improve healthcare. And the other, I guess the other thing too is just the quality of the data, and where that data is coming from. And so I think one of the things that we've really tried to do is take not only the regular structured data from notes and from laboratories and not, but adding unstructured data in a diary form so that patients can tell a provider how they're doing, and being able to summarize that unstructured data in a way that allows for increased communication and increased knowledge between the provider and the patient.
Well, that actually is really amazing to think about how you're leveraging AI and blockchain, of course.
Yes, of course.
To really create a new type of interaction between patients or users and what we call, the electronic healthcare record, or the interface to health information. And you're very humble, because we both know that Afia Record played a key role in reducing the amount of COVID in Kenya by using, a privacy secure, non-contact tracing to find loci of COVID. But I want to ask Michael, you're in a special situation because you are most of the time in the UK, and you're actually presenting to the local market Afia Record, which is very different than what they're used to. So how does that, I want to say, when Africa meets UK, if not say, East meets West or something like that, or North and South or whatever, but like when this type of solution, a Web3 patient-driven, tokenized solution comes to the usual very mainstream stuff in a system like the NHS, can you speak a little bit to how doctors respond to it, how other healthcare professionals or patients respond to this mobile app?
Yeah, absolutely. That's a fantastic question, because there's a lot of there's actually a lot to say on that front. So yeah, that's a good question. As they had the UK had, if you recall, it's been I wouldn't really say smooth journey, but it's been a challenging journey. But as challenging as it has been, it's been a very, very interesting one. There are loads of disparities that we face as part of the institutional system that has existed. Like Ron said earlier on as well, a lot of legacy system has existed here in the UK. And when you then look at the NHS, the way the NHS is set up and the way the NHS is structured, the whole ecosystem relies on the NI, which is the national insurance. So again, that then makes it very, very rigid to sort of like, build some sort of long-term sustainability partnership or arrangement with them, or some sort of a plan that would further enhance the whole health ecosystem. But the good thing in that front is that the NHS on its own as well is looking into, which they have started, like they launched a new app called the Hive. So again, which is a great app. So again, the NHS have come to that realization that, you know, smart technology and all the likes of blockchain and AI data, you know, with some serious research, again, which UK in terms of research is at the forefront. So again, is needed in terms of transforming the NHS ecosystem, because again, there is so much burden on the NHS, and that's again as a result of increased numbers of migrants coming into the UK. But having said that, the biggest challenges in terms of Africa meet the UK is trust. Again, you know, so there has been a long-standing mindset that, again, Africa is below. So again, that then simply means because Africa is below, there's not much to be expected from them. So then when the same individual or the same ecosystem that you expect less from, or little or nothing from, then becomes to redefine things for you in such a way that it makes beyond sense. It can be very challenging to accept it from, you know, somebody who you don't trust their services. And this is me actually being very, very blunt at this point, because solutions from Africa into the UK struggle. And the only thing that, you know, I'm just going to give one example, which is a little bit outside health. The only thing that manages its way into the UK sustainably or efficiently and still get the market value or still being able to drive the market is African food, because it's consumed by Africans. So again, going back to health, then any other thing aside that, when it comes into the UK as a result of lack of trust, and who do you blame for that? There's you know, the education standard in the UK and Africa is not the same. You know, Africa for a very, very long time has relied on the UK being one of the countries that, you know, one of the colonial countries that has quite a lot of colony in Africa. So again, Africa has looked up to the UK, America, and the rest of them for a very long time. So, you know, it's hard to change your mindset about, you know, somebody who depends on you, who is then asking for freedom and for equality and for things to be looked at, you know, with the same lens, if that makes sense. But because Africa has not really transformed as a result of bad leadership to, you know, tackle those issues around trust. And you cannot, you know, mention health without trust. Trust is at the forefront of healthcare. So, you know, and the biggest challenges we're now facing with our field record is, how do we then redefine that? How do we change that mindset? How do we, because our field record is such a wonderful, great platform that presents massive support to the NHS, even when you look at the amount of, or the influx of sponsored healthcare professionals coming into the UK. Again, this is where, as part of what we're looking to craft with the NHS, would make massive sense. And this is where our field record as well will serve massive, as a massive support and, you know, help the NHS in ensuring that the professionals coming in from Africa, imagine if the NHS have their record before they even come in.
Yeah, no, I
That
think
would be massive for the NHS, and that will solve a lot of issues. So I think trust, it's a big one in that. But having said that, you know, myself, I have lived in the UK for quite a while, so I understand that you just have to be consistent and continuity. So again, without consistency, you're not going to go anywhere. So we've been very, very consistent in our approach with the NHS. And we've been having some great talks. We've been able to build some few partnerships within the private sector in the UK as well. So again, when you then look at the private sector, which is a bit outside the NHS, again, our field record present massive solutions and support to the private health sector. But the majority of the people who would benefit from AFIA record mainly are people on the NHS, which is the public health care. So again, hopefully, fingers crossed, with talks fast approaching, I am sure we'll be able to bring some good news to the fore not too long.
Well, I think that that's a very good point that you're bringing, where trust. I always say blockchain is the software solution for the social problem of trust.
Yes.
And so clearly a blockchain-based solution makes sense in creating that computational trust and data integrity, but more so your point of education, post-colonial thoughts. I always said that Africa could be a technology exporter, and people are always amazed that, for example, both in East and West Africa, they've been using digital currencies or digital money for decades, whereas here in New York, cash is king. So there's still a little bit of, I want to say, global humility that needs to come into play. We're coming towards the end of our session, so I want to ask each both of you, and I'll start with Ron and then you, Michael. The same question is, and you can choose which one, it's both sides of the same thing. What should we, as in the Western world or the obese economies, like I like to call them, what should we learn from Africa? And the opposite is, what shouldn't Africa learn from us and what we've been doing in healthcare? So Ron, let's start with you.
So I think there's two concepts, and I'm again coming back to this Ubuntu. I'm really glad you brought that up, because and you mentioned this. I mean, the U.S. is and other obese economies tend to be a little more individualistic. I think the U.S. is probably the top of the list of that, as far as individual actions, individual outcomes. Whereas, as I was saying before, this concept of Ubuntu, of this collective responsibility. I mean, that's how you can solve issues. And I say that from experience. When I was at University of Utah, this was one of my jobs, was being responsible for collective accountability for outcomes. And let me tell you, that was quite a challenge. And unfortunately, the most resistant population within, the 10,000, 11,000 people at University of Utah, guess who that was? It was physicians. And so, so I think particularly that the medical field can learn a lot from Sub-Saharan Africa with this concept of collective responsibility and collective accountability. And and the other point is exactly what you're saying about the obese economies. So the obese economies, the obese healthcare budgets of some Western countries, with the US being at the top of that. AFIA Record has operated on shoestring budgets for years, from our startup time in 2019 to now 2023. So we're 3+ years into this, and we've done an amazing job where we have a state-of-the-art healthcare platform using both AI and blockchain to help predict disease in regional areas, help manage healthcare in multiple over multiple venues. We've done this on a very small budget, and we'll continue to do this on a small budget, comparatively speaking. This concept of camels that I think John Kamara brings up quite a bit, I think is quite appropriate. I mean, we're able to go a long way with very little resources. And so when you have a lot of money, I think there's blessings and curses to that. The blessings, of course, is that you can get things done. The curse, of course, is that you don't know how to get things done if you don't have the resources. So, I think those are probably the two things that the U.S. can learn from that. Or the U.S. and actually other Western economies. So.
I love it, Ron, and not unicorns, which are not real, but more camels that do the mission with very little and are very frugal. In 2 minutes, Michael, because we need to wrap up here. What shouldn't Africa learn or take from the obese economies? What would you say when I'm in the continent and everybody speaks about how we have to emulate everything because the West is the best? What would you caution the fellow folks in Africa?
Yeah, I think, 1 second.
Well, I think we lost Michael for a second.
Sure.
So again, I want to thank the panelists. Michael, are you with us?
Yes, I'm here. Yeah, sorry about.
So now you have 1.5 minutes to wrap up. What is the right thing or the right future for Africa and African health?
Yes, I think Dr. Ron did mention some very, very interesting thing, but for me, I think the first thing for that, the West can actually learn from Africa. Again, if you look at technology as well, it's all about the mindset. So I think the African mindset in terms of resiliency, because like Dr. Ron said, in terms of education, even if you look at the medical sector here, there's a whole lot of Africans coming in redefining the odds, and so there must be, even with the difficulties in Africa, because these individuals weren't born here, so they were born in a place that has little or nothing, but then they have been able to use that little or nothing and make massive and huge change and huge differences with it. So I think that is something they can learn, the resilient spirit of the African. That's one thing they can learn. And again, I think what Africa can actually learn very well from the West is not cutting shortcut, not following shortcut, no shortcut, follow the process, always believe in the process. And I think that's one thing Afia Record has done magnificently well, not looking at easy way out, but most importantly, following the process, no matter how rigorous it is, but with the right resilience to drive and to sustain that rigorosity to then ensure that the whole solution ecosystem is delivered on a tangible ground, and in terms of other interesting things that comes into it as well. I think if we Africans adopt that mindset of process and apply that into our daily life as Africans, and because being an African, I know we like to cut, we like shortcuts, but if we can go through that fire, that process, I think there's a joy at the end of it, and not just the joy, but there's a massive accountability, transparency. And again, this is the whole thing technology is all about. So I think the mindset, the resilient mindset of the African, it's something that could, which has brought us so much success. I think that's something the West can learn. And I think what Africa can learn is the process, the gentle or the ease way or the ease process at which the West do things. For example, in terms of research and development, R&D, they go through it through the very end. So again, I think, if the two merge together, then you have the best of both worlds.
I love it. Well, we started with Ubuntu and we ended with Ubuntu, that none of us is as good as all of us, and then we have to share and we have to work together. I want to thank both of you, gentlemen. It's been a fascinating 30 minutes and something that I'm sure that the audience is maybe for the first time hearing all about this. So I want to thank you, and I want to wish you a pleasant continuation of your day. Thank you so much, and Godspeed.
Thank you very
Thank you
much.
so much, Alex, Dr. Alex. Thank you so much. Really
Thank you
appreciate
very
it.
much, Dr. Alex.
Hmm.
Thank you, Tori. Thank you, Dr. Ron.
Yeah, and thank you, Michael. This is fun.